Personality disorders. So, personality disorders, it basically comes under clinical psychology. So, there is a lot to discuss under clinical psychology, but I am going to discuss at length only about different types of personality disorders. And you should know that these disorders are categorized into cluster A, B, and C. Now, we also call cluster A as mad and B as bad and C as sad. There is a reason, of course, there is a reason behind it, which I am going to disclose as we get into the discussion about these disorders. But before that, I want you to know that what is personality disorder? Now, personality disorder is it's a type of mental disorder in which people they have this rigid and unhealthy pattern of thinking, functioning, and behaving. So these people they have too much trouble in perceiving and relating to situations and people. And this is what causes significant problems and limitation in their relationships, in their social activities, in their work life, school life. It actually begins very early in their life for most of them, uh, in their teenage and in their early adulthood. So in some cases, these people they do not realize that they are suffering from a personality disorder, because what they think is that their thinking and their behavior is very natural. It's normal. And what do? They actually blame others for all what is going wrong with them, or the challenges what they are facing in their lives. So they most of them they behave like this. Now let's get into the discussion of your first, that is cluster E personality disorder, which we also call as mad. Now, why do we call them as mad? Okay, now I have already written here the reason, because they act very and they think also very in a very odd manner, in a very eccentric way, which is why we you should also know that when you come across with such kind of patients or people, you you guys tend to call them as mad. Is he mad or is she mad? How can she behave like this, or how can she think this way? So I'll tell you, why it happens. Why do you get this impression of the other person being eccentric? First, okay, now there are three personality disorders under this cluster, and those are schizotypal, schizoid, and paranoid. Now, you must be thinking this is sounding so similar to schizophrenia, but they are not the same thing. Schizophrenia, it's a psychotic kind of disease in which they have delusions, they have hallucinations, and if you go and talk to those people about their delusions and hallucinations, that they are uh, they won't believe you. You can never convince them. Rather, they will be finding you crazy. Instead of finding a problem with themselves, they will be labeling you as crazy. So they will never ever get convinced. However, you won't see that kind of problem among in this category. But schizotypal, yes, they do get these illusions, but they are ready to listen to you. They will get convinced if you will explain them, no, this is all false, this is your false belief, there's nothing like that. And they will readily get uh, they'll get to believe you. But you must know that there is a genetic link between you know these disorders and schizophrenia. So some people they do say that these people who are suffering from cluster A personality disorder, they can become schizophrenic later. There are chances that they might become schizophrenic. So let me first talk about schizotypal. You must listen to me carefully when I am talking about their signs and symptoms, because they do overlap a lot, and which is why, psychologists, or we as people, we tend to get confused between them. So schizotypal, they're basically loner kind of people who are always lonely. They stay alone. They do not have much of close friends. And when we talk about emotions, these people, they have very flat emotions. Their emotions are, I mean, you can call them as very cold people, which is why their emotional responses are extremely inappropriate. Another problem with them is that they have this excessive and persistent social anxiety. And they do behave like paranoid personality disorder patients, because they always have this suspicion in their mind that the other person is having some hidden motives against you. So even if the person is completely harmless or inoffensive, but they think that there is something wrong going on in that person's mind against you. Their thinking is very unusual. They believe in that magical power, or superstition or superpower. So they have beliefs in those things. They also get these illusions, but as I said, if you will talk to them, try to counsel them, they will listen to you. They are ready to listen to you. So you can convince them. And as I said, they always doubt other person's loyalty towards them. Now, these are the distinct features you will notice in them. That, first of all, as I said, illusion thing. And another thing is that their way of dressing is very peculiar. They will wear something unusually matched stuff and appear in front of the public. And, you as a spectator would be like, what the hell that person is wearing, and why, how could they wear, this kind of clothes and come out in public? So you will have that kind of impression. And also, if you will notice their speech, that is very peculiar. I mean, the style is peculiar. They will elaborate the conversation, and it's very vague also, and they tend to ramble a lot. So you'll find those things in such patients. So now let me tell you the most important thing. As I am discussing all these disorders with you, you do not have to think yourself as one of them, or somebody else around you as one of them. So don't just get into diagnosis of people. So don't do that. Just try. I just want you to know these disorders so that you can evaluate people well. You should know how you have to deal with them. You should know what kind of advice you should give out to them. So the handling becomes easy for you, but you cannot just go on and label that person as, he or she is suffering from this kind of personality disorder. You cannot do that. There are specialists who are sitting over there who has got this knowledge and job, extensive knowledge, to do the diagnosis, proper diagnosis. So this is just for you, for your knowledge. Okay. Schizoid now. You will see many features will be overlapping with schizotypal. So, but there will be few which will make it distinct. So listen to or note down those features on your notebook if you have any. Now, schizoid, they are again, prefer to be alone. They choose those activities where they have to work all alone. They do not like, much people around. They don't have close relationships. They don't even enjoy it. They they don't have much desire for sexual relationship. They feel that they cannot have pleasure actually in life. They are very cold kind of people. Even their emotions are completely flat. Their emotional responses are inappropriate. They lack motivation and goals. You praise them or you criticize them, you won't find them reacting in any way. They just don't respond much. They are humorless. They are lifeless actually. Very indifferent. They are emotionally extremely cold. Yeah. Now, as I said, there are a few features which does match with the previous ones, schizotypal. But when these people speak, speech, just concentrate on their speech. When these people they speak, they do make sense. And although they cannot handle their life properly, but in workplace, if you give if or allow them to work alone, they can actually do well. Otherwise, it is difficult. And they do not have any problem of hallucinating stuff or those delusion and illusion. No, they are very much in touch with the reality. So that's how you can actually distinguish. Now, paranoid personality disorder, uh, I find this very interesting because I have dealt with people who were suffering from this disorder, and I have closely dealt with these people. So they are essentially characterized by people with relentless mistrust and suspicion of others. So they are very suspicious. They cannot trust anyone without adequate reason to be suspicious. They will just go on and suspect that person. Very skeptic. Now, if you will see, they will have their close relatives who could be suffering from schizophrenia or any delusional disorder, which actually suggests genetic link between the two disorders, the paranoid and schizophrenia. And uh, or else they say that maybe they have suffered from some kind of physical or emotional trauma in their childhood, which has caused them this kind of disorder. Now let me give you a view of the signs and symptoms which you will see. Now, as I said, they cannot trust. Honestly, they have big time trust issues. They doubt commitments, they doubt loyalty, trustworthiness of others. They believe that others are trying to deceive them, exploit them, trying to use them. And you will see, they will behave like that. They will talk about, um, okay, that person ditched me, or this person cheated on me, or that person did that to me. Everybody is cheating on them. They are using them, they are exploiting them. They they cannot, they do not share their information with anyone or their secret, because they think if they will do that, they will other person will be using those that information against them. So they do not confide in any other in any person. They cannot forgive you easily. They will always hold grudges against you. They are hypersensitive. They take criticism very poorly. I'm telling you, even if you're not criticizing them, they will think you're criticizing, and then they're gonna, blast at you. They do that thing. They will always read hidden meaning in innocent remarks or casual looks of others. Every They are thinking, everything is having hidden meaning, and that is against them. They perceive attacks on their character that are not apparent to others. They generally react with anger and are very quick to retaliate. They do retaliate badly. Let me tell you. And anger is always, you will see every time they being angry, they being retaliating. So, so very violent at times, extremely violent. Now, yes, they have this persistent suspicion without reasons, and that their spouses or lovers, girlfriends, boyfriends, whatever, they are being unfaithful to them. They will keep suspecting you no matter what. You have not done anything, you know that, but even if they have no, I mean, they have got no evidence, they have got no reason. They just assume stuff, in their mind. They build up stories and they believe in that strongly. They're generally cold and distant in their relationships with others and might become controlling. Of course, they do become very controlling and jealous to avoid betrayal, because they do not, they so say, somebody is, you are in close relationship with, such person, and they think that you are cheating on them, betraying them, but they want to be with you. So what they become, what they'll do, they become very controlling. They want to have you in their complete control. Okay, you should tell them where you're going, where are you at this time. If you have taken long somewhere, why did you do that? Just, you have to be answerable to them every now and then. Otherwise, you are doing something wrong if you're not answering them. Yes, extremely controlling and jealous. They cannot see their role in problem or conflict. They believe that they are always right. They think they're very smart. They think they're genius. They can, actually understand things very well. And they have difficulty relaxing. They're hostile. They're stubborn and argumentative. Argumentative mean, obviously that's what they do, because they are suspecting your intentions every time, everyone's in fact. So they tend to develop negative stereotypes of others, especially those from different cultural group. So this was about your cluster A, and in next lecture we will be discussing about cluster B. So stay with me.